to bring Tina up because I want to talk to you guys. People don't understand. So when Coach Sarah sits across from someone and teaches them TLS, I am a TLS coach. But when a health provider like Tina Rose, because she's a nurse practitioner, when she sits with someone and talks about weight management, it's now TLS Select because you have so many more tools available to you. Tina's not one of my personally sponsored, but she is in my organization. So I always say if I'm going to teach it to you guys, I'm going to do it first within my own organization. So Tina, thank you. But let's talk about the story behind TLS Select. Tell them what type of practitioner are you, first of all?
Do we have it on?
Is it on? Yeah, it should be.
Okay. I'm a women's health nurse practitioner, and about 7 years ago, I opened my own practice.
Okay.
And I was forced to open my own practice because I was laid off from when corporate America came in and bought the hospital group after 21 years. And my thoughts were, well, who's going to take care of my patients? And it's very difficult as a nurse practitioner to open my own practice. But I was very blessed that my dear friend and your sponsor, as well as my sponsor, Dr. Sheila DePelt,
Thank you,
introduced me to nutraMetrix at a time when I was wondering if I was going to be able to keep my practice open.
Yeah, and you did great with nutraMetrix, but something changed about 1.5 years ago.
About 1.5 years ago, I went into business with another nurse practitioner partner, and I think she had the mindset that, well, we'll try it for 4 years. And I had the mindset that this has to work, and it's going to work because, as JR says, I'm going to make it work. And about 1.5 years ago, she left the practice, took a job somewhere else, was working about 1 day a month to keep up. And I realized it was all on me, and I had to find a way to make it work. So I really delved into nutraMetrix TLS. I had already been doing some TLS, but didn't take it seriously enough and didn't start offering it as a method to care for my patients fully, holistically.
And at that time, we were talking about TLS, but we were just talking about it to our practitioners, like go to the training, and we weren't necessarily bringing it to you. And so you can find on meeton.com, I did a TLS Select discovery meeting that I then duplicated and put into the TLS Select implementation guide that you can find in your nutraMetrix downloads. And you were my first discovery meeting.
And you changed my whole practice.
And what was the first thing, though, that you changed?
I brought on a registered dietitian, master's prepared dietitian. I contract with her, and she comes in and does one-on-ones with my TLS Select clients. I meet with them individually, get their health history, order lab work, and go over the programs with them.
And what are your 4 offerings that you have?
I have a very basic, just the TLS 21-day challenge, self-directed.
They walk out with the suitcase.
My annual exams, they come in for an annual exam and they fill out a wellness form and they mention that they would like to lose weight. And I tell them about the 21-day challenge, or they've seen my flyer in my living room, our waiting room, and they'll walk out with that. Others really want to go into more depth, and then I make them come back for an appointment to discuss weight loss with me. And then I offer them one of my 3 programs. I have a 4-week program, which includes the 21-day challenge and all the supplements they need, plus 1 visit, the journal is a must, and 1 visit with the dietitian. And then they can go on from there on their own. It's a jump start, I call it. Then I have a 6-week program, which includes enough supplements for the 6 weeks, the journal, the TLS 21-day, and 2 visits with the dietitian. And how much is that? That one is $5.99. And then I have my value pack. My biggest seller is the 12-week program, which includes the 21-day challenge, enough supplements for 12 weeks. In addition to the core, they get 1 additional supplement. And that one includes 4 visits with the dietitian and the gene snip.
And what do you price that at?
And that one is $12.99.
$12.99, and that's our biggest seller. And so these were your offerings, and patients have loved it. Tell me a little bit, though, about how the patients have responded, and has it increased the practice?
It saved my practice. Word of mouth has spread that I'm doing weight loss. I have patients that will take my flyers. I have the flyers that we have in the back office.
And these are the trifold brochures, is what she's calling the flyers.
And they're, even some of my patients have brought them home to their husbands. I'm a women's health specialist, so I only have women patients, but for TLS, part of taking care of the woman is taking care of their relationship, I guess. And they'll take it home to their husbands. And so I have coached a couple of husbands. I don't do billing for them. I do bill for my services, for my patients, my time with them. I have a diagnosis that I can use, and I do lab work. And I'll focus on the medical issues related to their weight, and the dietitian will focus on their diet and their food nutrients and all of that. The gene snip has been phenomenal, and that's helped me attract even more patients. So about a year and a half ago, I could have looked at closing my office, and now I have since hired a medical assistant, which means I don't have to wear as many hats as I used to wear. Administrator, medical assistant, biller, nurse practitioner, sometimes janitor. And so now she helps keep my inventory. She does all my receipts, and I have the dietitian that I contract with. And
that helps you get to Ricky's football games on time.
As of September 6th, I have a new nurse practitioner coming in 2 days a week to help me see my patients. I'm booking out 3 months in advance right now.
Wow.
Which,
wow.
And I used to work really late at night and on weekends trying to catch up with all my notes. My son is a teenager playing football, going to a sophomore year in high school, and last year I probably missed more games than I was able to make. And this year I'm planning to get out of the office at 4. His school's right down the street. I can make all his games. I've got another nurse practitioner coming in to help me with the overhead, so that I can focus and bring in more of my weight loss clients and still continue to do my GYN.
And what's the next 5 years look like? What did you just do?
I just upgraded to a bigger suite. Actually, it's a small suite, but it's a brand new suite.
Brand new. No, it's a nicer suite. Yes.
Beautiful suite in a medical building. And I signed a 5-year lease. So I'm in it for the next 5 years, committed for the next 5 years, and the new nurse practitioner is coming in, and I'm hoping to groom her, and she's going to end up increasing her hours as we grow. And in 10 years, I hope to sell the practice to her and continue this nurse practitioner model of care, holistic wellness.
Awesome. How amazing is that? And this is just one example of what we're doing and what we can do, and it's a system and it works. And while other practitioners who are in private practice are thinking about closing, Tina's expanding. Tina's attracting more. Tina has a plan, and it has just been so phenomenal to work with you. So
and I thank you, Sarah, because I couldn't have done it without you.
Congratulations. Thank you, Tina. I also want to say that Tina, in the top 21 sales, she was in the top 100. She's consistently in the top sales for TLS and nutraMetrix in the Northeast and continues to grow. So